Welcome to our May Wellbeing webinar on Stroke Awareness 101, brought to you by Univera Healthcare. I want to start out by thanking you for taking the time out of your afternoon to join us here today for our fifth webinar, part of the Understanding Your Wellbeing webinar series that we launched in 2025 for our members. My name is Katie Keller-Burgess, and I am part of the Wellbeing team here at Univera Healthcare. I will be the host for today's webinar, teeing up our guest speaker, Dr. Kelly Bershu, who will be presenting the majority of the content for today's webinar. So, for those of you who may not be aware, May is actually National Stroke Awareness Month. I apologize. I just want to confirm, Kim or Kate, can you see my screen?
I can see your screen. It's just the title screen, Katie.
Perfect. Thank you so much for confirming. All right, so for those of you who may not be aware, May is National Stroke Awareness Month. Research shows that someone in the United States has a stroke every 40 seconds, and it can happen to anyone. I am sure some of us on this call have had stroke impact your life to some degree. Maybe it is yourself, maybe a friend, a family member, a coworker. I myself personally lost my dad almost 5 years ago due to a stroke. So that is why I am so passionate about strokes and what to be aware of when it comes to them, and why I am so excited to have so many of you here with us today to learn more about this topic. All right, so a few housekeeping items that I do want to start us off with here today. Please note that today's webinar and all of our 2025 wellbeing webinars are being recorded and are being housed on our Univera Healthcare YouTube page. So if you need to go back and listen to this webinar or access a past or maybe a future webinar that you're unable to attend, you will have that on-demand access to the monthly wellbeing webinars once again right on our YouTube page. Another housekeeping item that I do want to call out is that all of our participants' microphones and cameras are automatically disabled. There will be time at the end of the webinar for questions with our guest speaker. So we do encourage you to utilize the Q&A feature within the Teams webinar and enter any questions that you may have at any point throughout today's webinar. And once again, at the end, we will get to time for questions with Dr. Bershu. And lastly, it is important to note that the content covered today is simply educational in purpose. If you do have any specific health-related questions or concerns, we recommend that you connect with your primary care provider. Or if you have any benefit-specific questions or concerns, we recommend to call the customer care number that is on the back of your Univera Healthcare member ID card. All right, so with the housekeeping items out of the way, let's go ahead and learn a little bit about our guest speaker. I have the pleasure of introducing Dr. Kelly Bershu, who is one of our medical directors here at Univera Healthcare. Dr. Bershu is board certified in internal medicine. She has Buffalo roots through and through, as she graduated from Canisius University and obtained her medical degree at the University at Buffalo Jacobs School of Medicine. She then went on to complete her internal medicine residency and chief residency at the University of Rochester Strong Memorial Hospital. After completing her residency, Dr. Bershu worked in New York City as an academic hospitalist and then returned to Buffalo, her hometown, to work as a hospitalist and continue her academic career as the Associate Program Director at the University of Buffalo Internal Medicine Program. Her academic career focused on teaching clinical skills at the bedside to enhance patient care. And during the pandemic, she transitioned to a career in occupational medicine before joining the health plan in 2022. Since joining the health plan, Dr. Bershu has successfully launched and expanded the Duals plan and has dedicated her quality improvement efforts on ensuring that member-centric care with a focus on members residing in subacute rehabilitation as well as long-term care. Dr. Bershu continues to live in Western New York with her husband and two young children, and of course is a passionate Bills fan. So Dr. Bershu, we are so thrilled to have you here with us today. I will turn the stage over to you.
Thank you, Katie. I appreciate that introduction. So, as Katie mentioned, our topic today is going to be what is a stroke. We're going to talk about types of strokes, signs and symptoms of stroke, risk factors for stroke, importantly, how to prevent a stroke, how to recover from a stroke, and then Katie's going to take back over and discuss some additional benefits and resources offered through the health plan. So first and foremost, what is a stroke and why do we care about it? A stroke occurs when something blocks blood supply to part of the brain or when a part of the brain, small blood vessel bursts, leading to a hemorrhagic stroke. Um, Due to the loss of blood flow, either from the part of the blood supply being blocked or from the blood vessel bursting, the brain can become damaged and parts of it can die. Stroke is the leading cause of long-term disability in the US and the fifth leading cause of death. So as was mentioned in the introduction, the American Heart Association says that someone in the United States has a stroke every 40 seconds, so it's exceedingly common. There's a number of risk factors for stroke that we'll talk about in more detail in the next few slides, but just to name a few, high blood pressure, high cholesterol, smoking, obesity, diabetes, and 1 in 3 adults in the United States has at least one of these risk factors. Some have multiple. And 2 million brain cells die every minute during a stroke. So as we'll talk about in future slides, time is really of the essence. So a couple different types of stroke. An ischemic stroke is the one that I mentioned first. Most commonly, it's when a blood clot blocks blood flow in an artery within the brain. Fatty deposits, or the medical terminology for that is called a plaque, can also lead to narrowing, and that can decrease blood flow, especially if there's a drop in blood pressure, and those can both cause an ischemic stroke. A hemorrhagic stroke is when there's bleeding on the brain, and that's secondary to a blood vessel bursting. A transient ischemic attack, which we'll also talk about in a little bit more detail shortly, sometimes called a mini stroke. It's actually a misnomer because it is temporary blockage of blood flow in the brain, and it is a warning sign of a future stroke. So the medical definition of a TIA is when we don't see any changes on imaging, which we'll talk about in a little bit more detail as well. This little picture here kind of depicts the two different kinds of stroke. This one here shows the blockage of an artery. This is right here is a little embolic clot that probably came off. Oops, I apologize, from the heart. This one here shows a rupture of a small artery, and you can see the accumulation of blood here on the brain. The majority of strokes that we're talking about are ischemic in nature. About 87% of all strokes are this type of stroke here, related to the blockage of blood flow. And the good news is that these can be intervened upon. So when we talk about signs and symptoms, the timing of this is very important because some of the interventions are really time sensitive for the ischemic strokes. Pivoting a little bit, we're going to talk about signs and symptoms and how you can be impactful in your communities by recognizing signs and symptoms of stroke. So the mnemonic be fast, again, time is of the essence, is a good way to remember how to identify a stroke in those around you. So B stands for balance. Does the person have sudden loss of balance or coordination? So are they stumbling when they walk? Eyes, does the person have sudden, blurred, double, or loss of vision? F stands for face. You can ask the person to smile. And does one side droop down so they have asymmetry in their smile? Arms, you can ask the person to raise both, and sometimes one will drift or they'll be unable to lift it completely. S stands for speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Are they unable to repeat what you ask them to say? T stands for time. If you see any of these signs or symptoms, it's imperative that you call 911 right away. So, as was mentioned, I was an academic hospitalist for a period of time. And when I worked at Buffalo General, I was often on the stroke floor as a hospitalist. So I would see people after they had gone through the emergency department and seen a neurologist and had imaging that confirmed that they had a diagnosis of stroke and potentially had one of the life-saving interventions that are available. What I had never experienced was an impact of stroke on my own life until 2017. And I think my story, hopefully, will just remind you that you really can be an impactful person, and even as a physician, I had never put something like BFAST into motion because I had not had to, because the diagnosis had already been made for me. The week of my wedding, I had gone for a run and I returned home, came around the corner, and my elderly neighbor was at the curb and looked like she had fallen. She was trying to pick up her glasses. And I immediately took off my headphones and, went to assess what was going on. And she was having a very hard time formulating sentences, was really relatively nonsensical, which was very atypical for her. She was usually a really sharp lady. And I, started to ask her to try to do a few things, smile, raise her arms. And it was clear that she really could not only could she not do some of those things, she really couldn't follow my directions. I tried getting a sense, did she hit her head when she fell? It looked like she had a cut over her eye, her glasses were broken. So I was in, real time trying to figure out, is this a stroke? Is this a head injury? Does she need to go to the hospital? Because things always happen, at the same time. We were supposed to go get our marriage license in like an hour. And I called 911 and, I said what I was seeing and what was happening. The ambulance got there very quickly, which was great. And they were doing similar things. And she got to the hospital and she ended up having a very large hemorrhagic stroke. I wish I could say the story had a super positive outcome. It unfortunately does not, but like the timing of things did allow her daughters to get in from out of town and see her. Because of the degree of the hemorrhage, she unfortunately didn't make it, which is not certainly the outcome that we wanted, but it made me realize how important it is to know these things and to make sure that you're calling 911 as quickly as possible because they were there within 4 minutes of the call. And had it been an ischemic stroke, the outcome potentially could have been different. So additional signs and symptoms, again, kind of things to look out for. We mentioned that transient ischemic attack. So this is when you have something like in the BFAST, like maybe a facial droop or tingling, numbness, can't move part of your body normally, but those symptoms reside relatively quickly, usually within a few minutes to a few hours, but they can last up to 24 hours. Now, sometimes because these things self-resolve, they're dismissed, but it's actually very important that these are worked up in a similar manner to any other stroke. So those are when deficits do not resolve within 24 hours, because the highest risk of stroke is actually within the 30 days after a TIA. So it's really imperative that a TIA gets the same workup that a stroke would. So we mentioned that the BFAST is an acronym for a reason, because time really is brain. And it's really imperative that a stroke be diagnosed quickly. That's typically done with head imaging, a CT of the brain, or an MRI. And an ischemic stroke, again, the one we can really intervene upon the most, if that's diagnosed within 4.5 hours of those changes happening from the baseline, they're really eligible for a number of different interventions. And sometimes even in the 6 to 8 hours after, Buffalo General and South Buffalo Mercy really have both have great stroke teams with a lot of different options to intervene upon people who have a blocked artery. The next thing we're going to talk about is stroke risk factors. And the way I like to think about these is that there are a number of things that we can modify. We can work on our behaviors around those risk factors. We can take medications at the direction of our physician and providers to help lower that risk of stroke. And there's some things that we're unfortunately just stuck with because of our genetics, sex, et cetera, which we'll talk about. So stroke risk factors, we mentioned that history of a stroke and then the transient ischemic attack, that's really the highest risk. If you had one before, we already know you're prone to it. And if you had a transient ischemic attack, the risk is highest in the next 30 days. High blood pressure is sometimes known as the silent killer. And that's because we often don't know we have it until something happens, a stroke or a heart attack. Because it's not perceptible, which is why it's important to get that annual well visit, get your blood pressure checked. You can check it in a grocery store. Those little cuffs are actually fairly accurate. And if it's high there, it's always a good reason to call your doctor and get it checked out. High cholesterol. So the high cholesterol is really that LDL that we're talking about. Cholesterol is broken up into a couple different parts, triglycerides, HDL, which we think about being high because we want the H as high as possible, and then the L kind of being the bad cholesterol. Again, that's something that can be impacted upon with medications and healthy diet, but sometimes we're just prone to it by genetics too. Heart disease is kind of an all-encompassing group. So coronary artery disease, that's when we have plaque buildup within the arteries that supply blood to the heart. Heart valve deficits like mitral valve stenosis, aortic valve stenosis, regurgitations all increase the risk of stroke. Irregular heartbeat, the most common one particularly as we get older, is atrial fibrillation, which predisposes those that have it to an increased risk of stroke. And enlarged heart chambers, this may happen with heart valve defects or cardiomyopathies, can also increase the risk of stroke. Kind of one that's newer, probably in the last 10 to 15 years, becoming increasingly more common is obstructive sleep apnea. And these things all kind of work together to increase risk of stroke. This increases rates of high blood pressure, coronary artery disease, all in turn, which increase our risk of stroke. Additional risk factors, so diabetes, obesity, and sickle cell disease. So diabetes, having high blood glucoses that are not well controlled over long periods of time, increase the risk of plaque development, increase the risk of small vessel disease in the brain. All those increase our risk of stroke. Obesity increases our risk of all of these things in a metabolic syndrome. So that's when you have increased adipose tissue that leads to increased risk of endocrine diseases like diabetes, increases our risk of sleep apnea, high blood pressure. So that kind of works together to impact all those other ones. Sickle cell disease is a genetic disorder in which those who have it are born with a genetic mutation in the gene that forms hemoglobin. Hemoglobin is part of our red blood cells and is responsible for carrying oxygen. This disease basically causes the blood vessels to, or the blood, excuse me, the red blood cells to be a different shape. That's where the term sickle comes from. They're actually more oval shaped and they're stickier. They don't flow through our cells, particularly the really small blood vessels, as easily as a typical red blood cell. They're not as flexible. They're more prone to breakage. And because they're not as good at carrying oxygen, all these things predispose those with sickle cell disease to stroke. And they do have different screening parameters. For those with sickle cell disease, they have certain things that they should be getting done on a regular basis, and obviously at the discretion of their healthcare providers. So behaviors that increase the risk. Now, the good news is when I look at this slide, it's a lot of doing all the things we probably know in the back of our minds we should be doing, but these account for about 50% of things that we can modify, and we really can make a big impact upon our health by doing some fairly easy things. And we can really modify the other risk factors like obesity, diabetes, hypertension, hyperlipidemia by doing some of these behaviors. So eating a diet that is healthy, is low in bad fats, so saturated trans fats, and trying to eat like whole foods is one way that we can decrease our risk. So not getting enough physical activity. The American Heart Association recommends that we get about 150 minutes of moderate physical activity per week. So that's something that we can impact by, going on a brisk walk, taking the dog out, those things. It doesn't have to be crazy, and it all, scaling to what we're capable of. Drinking too much alcohol is a behavior that increases risk. It can lead to increased blood pressure, which increases the risk of heart disease. And we probably might have seen the Surgeon General warn. It's also been linked to increasing rates of cancer, particularly in younger people. So all a good reason to cut back. Tobacco use increases the risk of stroke in a number of different ways. So nicotine, which is the main kind of addictive ingredient in cigarettes, certainly raises the blood pressure. And then the chemicals in cigarettes increase what we call free radicals, which basically cause damage to the blood vessels and red blood cells, which all increase the risk of our stroke. Things that we can't impact, as I mentioned, there's going to be some of them. So those with sickle cell disease can't change that, although there are some evolving technologies like gene therapies that some people have been cured of their sickle cell disease with. So race and ethnicity, some groups are just simply more likely to have a stroke than others. African Americans have the highest rates of stroke currently in the United States. And certainly availability to healthcare, environments in which we live, you probably have heard of food deserts. Those all impact the quality of life and increase the risk of stroke if people live in those types of communities. Age and sex. So as you age, there's a significant increased risk of stroke, particularly once you hit the age of 75. There's a significant increased risk, particularly among women. Genetics and family history. So if there's a history of some of these diseases, high blood pressure, heart disease, or stroke itself, certainly all increase the risk of stroke in future generations. So one thing I thought was really interesting was this next slide. This was brought up by one of the other physicians here at Univera. and really kind of struck me as pretty important, especially just, coming out of the pandemic and people being more isolated, working from home and, not having some of those availability of resources that previously existed, like for our people in the community who are older weren't going to the, gym and community groups that they previously had. Um, the being socially isolated is equivalent to smoking 15 cigarettes a day. And poor social relationships and kind of poor social constructs in general can increase the risk of stroke by 32%. Um, Group-based social activities, so whether that be going to a senior center or going to the gym, having your weekly bridge night, can all dramatically decrease the risk of stroke. So we're looking at a third reduction, which is actually higher than any of those other behavioral things that you can impact. So really trying to, go off the phone, go for a walk with a friend, is really a great community way to decrease your risk and the risk of those around you. So we talked a lot about things that we can do to modify, and we're going to talk a little bit about preventing strokes. We're going to talk a little bit more about those modifications that we can make. And I think preventing stroke is really the most important part of this talk, because we talked about stroke being the leading cause of disability in the United States. And more than 2/3 of people who have a stroke are going to have some type of long-term disability. And that's really impactful. We kind of go back to that social community connection being helping to reduce the risk, but it's kind of like one of those circles, right? If someone has a stroke, they're more likely to be isolated, then they're more likely to have another stroke. So really prevention is key. And this is where we all come in, working as a community together, reducing social isolation, and then doing some of these things that we're going to talk about. So we talked about, trying to keep our bad cholesterol low and our good cholesterol high, so that choosing healthy food and drinks, really eating whole foods, avoiding too much alcohol, eating foods that are high in fiber, limiting the sodium, which can raise the blood pressure, particularly if you have any chronic kidney disease. Um, Reading the labels, and if you need help with that, there's certainly assistance, talking with a nutritionist to help, which we do have here at the health plan to, help you interpret those labels if you're not sure what it means. Staying hydrated, so, drinking water, sparkling water, things without added sugars are all good ways to stay healthy. Prioritizing physical activity, we mentioned that goal of 150 minutes per week. Really great if we could make it a social activity too, working out with a friend. Even things like gardening and things are a good way to just get outside, not be sitting. Those things are all really positive and can have great impacts. I think we all probably know this one. Don't smoke. Smoking, again, is just kind of one of those things that increases the risk of a lot of bad diseases, heart disease, stroke. And if it's something that you've been working on and are trying to cut back, cutting back is a great first step. And if you really are desiring to quit, there's resources available. There's community support groups. The WellFrame app is available that has programs for smoking cessation and additional resources. One thing that was taught to me from an addiction medicine specialist that has helped some of my own patients cut back or quit, if anyone is on the talk is struggling with that, is putting the cigarettes that you smoke per day, say you're starting with that 15, um, putting them in a Tupperware container with a sealed lid, and every day, every week, every month, whatever really fits with your current lifestyle and, potentially just what's going on in life, trying to cut back one cigarette at a time based on the schedule that really fits with what's going on for you. And that way, and then if, say, you cut back to 14 cigarettes the following week after smoking 15 cigarettes per day for that week, you then take one out and you tear it up. So you can't smoke it. And doing that in a manner that works for you. Some people do it daily, some people do it weekly, some people do it monthly, but it really at least helps you cut back, even ideally helps you quit. So how can we talked about reducing risk, and then some of these things, you just can't simply do all on your own. I personally have genetically elevated high cholesterol. My grandparent had it, my dad had it, I have it. No matter what I eat, no matter what I do, my blood cholesterol is the bad cholesterol, the LDL is always elevated. So sometimes you need a medication, and that's okay. There's some things beyond your control. So speaking with your healthcare provider about medications that might be amendable, other things that you can do can all greatly reduce the risk. Controlling your blood glucose levels, so following them regularly with blood glucose checks or a CGM, depending upon what your provider thinks is best, and kind of just seeing what foods elevate your blood glucose if you have diabetes, trying to help make better choices are all things that you can do. So once someone has a stroke, what does recovery look like? So the good news is there's a lot of people that are expertly trained to help. Usually recovery starts right in the hospital. I mentioned that I worked as a hospitalist on the stroke unit. And there are a couple different types of therapists who are trained specifically to look at the areas of the brain that have been damaged or have died from the stroke. So there's a number of different issues that people can have post-stroke: trouble speaking, trouble swallowing, paralysis, potentially a side of the body, part of the body, difficulty with vision. And these therapists work with each of those issues. So speech therapists are trained to work on addressing deficits in speech. Sometimes people will not have access to the part of their brains that previously controlled language. So trying to get other parts of the brain to overcome that, or using reading and writing instead of spoken language. They also work with swallowing to ensure that hopefully that they can manage to eat by mouth. The chewing, the mechanisms, and the swallowing are all pretty complex brain functions. Physical therapists work on the motions. So sometimes people need adaptive equipment. If they are paralyzed, they might need a cane or a walker or sometimes a wheelchair to help with mobility. And they're trained to help not only the body to relearn, but to also use that adaptive equipment to help them regain their functional independence. Occupational therapists focus on gaining an independence with daily activities such as eating, drinking, toileting, bathing, reading and writing. So they're really working on the fine motor coordinations and hoping that those skills can translate again to going home, because that's certainly everyone's goal, right? No one wants to be in a long-term care facility. And unfortunately, stroke is one of the leading reasons why someone might need to go to a long-term care facility, because we talked about the long-term disability. So really the functional independence is key in getting people home, as is the adaptive equipment. I'm now going to pivot back to Katie so she can talk about the resources available here at the health plan, and then I'll be available for questions thereafter.
Wonderful. Thank you so much, Dr. Bershu. That was a lot of great information covered. And as you kept mentioning throughout, time is really of the essence. So being aware of the signs and symptom is so crucial. But really being aware of resources available through the health plan as well, I think is something that is helping to just educate our members. So if and when you do need to use them, they are there and ready. So as Dr. Bershu mentioned, I'll take the next few minutes to review at a fairly high level some of the tools, benefits, and resources that are available through Univera Healthcare to our members. I do want to call out that program availability of these benefits does vary by contract. So once again, if interested in confirming benefit eligibility of any of the programs discussed here, we do recommend calling that customer care number on the back of your health insurance card to confirm benefit eligibility. But the first thing I wanted to review is our Find a Doctor tool that is available through our Univera Healthcare online member portal or through our Univera Healthcare mobile app. So if you are looking for in-network providers specific to your plan, you are able to utilize the tool on either the web page or mobile app. And with that search tool, you're able to filter to a provider's specialty, their location, the facility that the treatment is being provided in, the languages potentially spoken at the office, if they're accepting new patients or not. So great tool to be able to find in-network providers, once again, relative to your plan, whether it be for medical, behavioral health, anything like that. You can enter search words. Maybe it's for physical therapy, speech therapy, things that Dr. Bershu mentioned. So great tool to be able to utilize. And then also wanted to highlight part of that tool is also an estimated cost calculator. So if you are specifically on maybe a high deductible health plan, being able to estimate for out-of-pocket cost can be very helpful. So this cost estimator tool is once again able to look at your plan specifically if you are logged in and estimate the out-of-pocket medical cost based on your year-to-year spending and appropriate deductible. So once again, recommend logging in for that to best see results filtered to you. Up next, Dr. Bershu mentioned the WellFrame app specifically for the smoking cessation program and resources available. But I wanted to, at a high level, mention our member care management team that is really on the other end of that WellFrame app. So, Univera Healthcare has a member care management team that is inclusive of a variety of healthcare professionals, such as registered nurses, registered dietitians, behavioral health therapists, respiratory therapists, and more. So, really, this team of healthcare providers is here for our members to support you, whether it be from little questions to big health challenges. Our members are able to engage with our care management team at no added cost, providing you guidance, support, and personalized care plans. If you are maybe interested in learning more about stress management or weight loss, physical activity, or maybe you are a member dealing with a chronic condition such as hypertension, diabetes, or high cholesterol. Once again, this team is able to support our members, providing that personalized guidance, support resources. And then, as mentioned, the WellFrame app is one way to directly connect with those care managers. So there is a direct chat feature embedded right into the app that you're able to securely and confidently connect with your care manager via text to make it convenient, flexible for you. So once again, a great benefit to be able to have that access to those healthcare professionals to answer questions, support you. And I do want to call out the access code when downloading and registering the WellFrame account if interested is Univera Welcome, all lowercase, all one word. Up next, I wanted to review the Perks for You program. So, of course, living a well balanced lifestyle, as Dr. Bershu mentioned, is really all about making good choices on a daily basis. And with the Perks for You program offered through Univera Healthcare, it can help you do just that. You are able to stay healthier for less with offers that have exclusive discounts on healthy programs, products, and services at local retailers and vendors throughout Western New York. So you're able to log into your member online account and once again, click on the Perks for You link under the Health and Wellness tab to access and receive those eligible discounts at those participating vendors. And then the last program I wanted to mention is the program called Vitalize through our partnership with Personify Health. So the Vitalize program is allowing our members that have access to it the tools and support they need to make small, everyday changes to your well-being that are really focused in on the areas that you want to improve the most. So maybe you are somebody that finds yourself really dealing with stress and interested in more stress management techniques. Maybe you're somebody that needs to improve your physical activity and try to get tips to do so throughout the day. Or maybe you're trying to eat healthier. All of, once again, those behavior choices that Dr. Bershu alluded to. The Vitalize program is able to provide you tools, support, and everyday tips to help implement those healthy behaviors into your routine. So another great resource to check out to be able to access and help you stay accountable on track with your well-being goals. All right. So with that being said, once again, a lot of great information that was shared from Dr. Bershu between those content as well as the resources. So at this time, we do want to open it up for any questions that anyone may have. Once again, there is a Q&A feature at the top of the Teams webinar. If you click on it, you should be able to create a post and enter any questions that you may have. Now, to get us started, Dr. Bershu, I did have a personal question.
Go ahead.
Dr. Bershu, it looks like Katie's internet might have dropped. Is she back now, Katie?
I know I just took control because I wasn't sure if that was part of the issue. I do see a question in the chat, though, that I can jump to while we wait to see if she's able to rejoin. Lisa asked, how effective are medications for atrial fibrillation at reducing stroke? So the medications that are used for atrial fibrillation, I would think of them as two different kind of pathways. So one is aiming at controlling rate, and those are not really, the goal is not reducing the risk of stroke there. It's just allowing people to not live at a fast heart rate, which can be uncomfortable, make them feel badly, might make them short of breath, things like that. The other medications are anticoagulants. So their goal is, so with atrial fibrillation, what happens if my hand is the kind of upper chamber of the heart and my other hand is the lower chamber of the heart? With atrial fibrillation, you lose, like typically the atrium, which is the top chambers of the heart. So the heart's four chambers, so you have two atrium. It typically contracts like this, and then the ventricle contracts. With atrial fibrillation, you lose that contractility of the atrium, and instead it kind of quivers at a very fast rate. That quivering and that lack of contractility can lead to what we call blood stasis. And that blood stasis can then lead to a clot formation. And that little piece of the clot breaking off are the emboli, that little piece that travel to the brain and cause a stroke. So sorry, this is kind of a long-winded response, but the medications that are used to treat that are anticoagulants. So their goal is to decrease the risk of clot formation. And if you have one of atrial fibrillation, your risk of stroke is calculated using something, sometimes by some physicians, something called the CHADS-VASc2 score, which that's an acronym that stands for risk factors for atrial fibrillation. So some people with atrial fibrillation don't qualify or don't require one of those anticoagulants because the risks of using them outweigh benefit. For those that do qualify, it's actually a pretty significant risk reduction. I don't have numbers pulled from the top of my head, but overall, they do a pretty good job of reducing the risk of clot formation, and significantly, therefore, reducing the risk of stroke. Does that answer your question, Lisa? I think you'd have to probably put a response in the Q&A. I don't think able to speak. And then Catherine also asked, are strokes considered hereditary? So yes, in that, like, if there's a history of strokes in the family, that does increase the risk of stroke in future generation, but it's often those underlying other risk factors that predispose to stroke. So the high blood pressure, the high cholesterol, some things that those are genetically predisposed. And now the good news, like we talked about, we can use our behaviors and medications to impact and reduce the risk. And some of those things just simply didn't exist in other generations. We have certainly benefited from a lot of pharmaceutical and medical advances. Some of the treatments for ischemic stroke some of the stuff that's happened didn't even exist 10 years ago. So we really have come a long way from a lot of perspectives to reduce and treat strokes effectively.
Dr. Bershu, thank you. Hopefully everyone can hear me okay. Sorry about that internet issue there. Can you hear me okay?
Yes, we have.
All right. Perfect. Thank you so much. Some great questions asked already. I heard some of the follow-up information, so thank you for sharing. I'm not sure where I cut out, but once again, I wanted to ask more of a personal question and just see if you had any guidance. I know you had mentioned, that certain types of stroke can be kind of a mini stroke, right? And it can be kind of that first stroke before another stroke happens, potentially within 24 hours or so. Do you have any recommendations? Say you have a strong-willed family member, friend that you may recognize signs of a mini stroke, and you say, "Hey, this something's going on. We need to get to the doctor. We need to call 911." But you have somebody who is not receptive. They're pushing it off. They're thinking it's nothing. Do you have any suggestions for how to best manage when you potentially recognize those signs and symptoms, but the person themselves is not ready to try to get care? Any thoughts around that?
So, I mean, that's obviously challenging. I think one of the issues with a TIA is you're not certain when you first recognize that those things are going to self-resolve, right? Like,
Mhm.
so I think reminding the person that, you can't be impactful you can't do anything in the community, right? Other than recognize. We talked about you really should call 911 because time is of the essence. So when speaking to my stubborn elderly neighbor, she was hesitant to go by ambulance. She seemed a little confused, but was, kind of adamant she didn't want to go. And I said, you have to go. I can't be the one to say that you're okay. Like that has to be someone in the hospital. You need imaging. Um, and I think the essence that like you're not certain this is going to get better, right? It could get worse, and you just can't be impactful. There's nothing you can do in the community to stop a stroke, right? It really needs to take place in the hospital, and I think I would stress that. And if they're still reluctant and those symptoms have resolved, at least encouraging a follow-up with their primary care physician so some of those risk factors can at least be addressed. Was their blood pressure, 190 over 100? The goal in the setting of a stroke would be less than 130 over 80. Goal in general is 140 over 90. How is their cholesterol? Have they had that checked recently? you know, I would really encourage anyone with TIA-like symptoms to be evaluated in the hospital because they might be in atrial fibrillation, which might go undetected. Sometimes it's hard to distinguish on exam that someone's in that rhythm, which really, does increase risk of stroke. So I really would encourage a hospital, to be evaluated. But if they're reluctant, I think at least a follow-up with their primary care provider in the community would be at least a first step in the right direction.
Wonderful. Yeah. And I think just the checking in right afterwards. My husband just got back from a round of golf the other day and said someone on the second hole, started having blurred vision out of nowhere. And, by the third hole or fourth, they were okay. But I'd said, has anyone checked on him since, recognizing the signs and
Hmm.
symptoms of the stroke, and thought to myself, once again, a TIA, things like that. So I
Yeah.
think that's why the importance of just knowing these signs and symptoms. So if
Yep.
and when you are seeing them or aware of them, you can help to maybe give that gentle nudge or push to, yes, seek care, because it can turn into something, obviously more massive down the line, if you will.
And common things are common, like maybe that person was feeling lightheaded, what we call pre-syncopal, which is like before passing out, on a hot golf course. But TIAs are fairly common as well. I always tell people I don't want to miss the scary stuff, right? And Catherine asked about, what are some main lifestyle changes that you recommend? I also tell people, I can't, like I told my neighbor, I'm not sure that this isn't something really bad, right? And I don't want to be the person to miss it. And in that case, it was something really bad, right? But I don't have a magical eye that can, see bleeding on the brain, you know. So, in terms of lifestyle changes, I think the most important things are really physical activity. We've been seeing, myself included, working from home, being more sedentary is just really bad for overall health, including, risk of increased, weight, which is therefore increases the risk of all other badness, diabetes, high blood pressure. So I'm really big on physical activity, getting outside, taking a walk. Fresh air, sunlight are all really positive things, things I've noticed that are impactful to myself working from home. And then just really trying to be mindful of diets, certainly easier said than done, but trying to, focus on eating whole foods. When you grocery shop, really trying to eat the rainbow. I always think of Jim Kelly, 5 for 5, go Bills. But those things like small changes really can make big impacts. So, getting up and moving. I'm standing now at my desk. I think those things are all really important for day-to-day living.
Absolutely. Could not agree more, especially with my passion for health and wellness, and just knowing how much those everyday choices really add up and can improve our overall well-being. So, with that being said, we are right at the 1:15 at the end of our allotted time. So, Dr. Bershu, once again, thank you so much for your time, your knowledge, your expertise here today. I'm sure all of us were able to take away even one small thing that hopefully we can bring forward into the community as we support ourselves, each other, and just look to be there for each other and our longevity of life. So once again, thank you everyone for today's time, for joining here today. We appreciate it. In the chat, I'm going to put, once again, the webinar is recorded and will be placed on our YouTube pages. So we will put that in the chat, Kate, if you wouldn't mind, and then this will be uploaded within the week. But then previous webinars, once again, also available on demand through there. So with that being said, thank you all once again. We hope everyone has a wonderful rest of your week and hope to see you for next month's webinar.